introduction.
Good morning. Hello, my name is Michael Grogan. I'm currently a volunteer here in CCBRT, Dar es Salaam in Tanzania in East Africa. I'm working with the managers in a disability organisation, a healthcare organisation, on developing the leaders in the organisation. I'm here with Dr. Brenda, who's one of the doctors in the organisation, and we're going to do a quick, brief 10, 15 minutes, 5-minute interview basically on her reflections on the state of maternal healthcare in Tanzania. Dr. Brenda, good morning.
Good morning, Mike.
Could you give me just a quick, brief bio of yourself and the number of years you've been in medicine and about your current job here in CCBRT?
Sure. My name is Dr. Brenda Dmello. I graduated 22 years ago from medical school. So I've been in clinical practice for 22 years, 14 of which were in the National Hospital, the New National Hospital, and six as a lecturer. And I worked in the Department of Ops and Government. So my passion has always been trying to make a difference to maternal health, improving maternal health, saving lives. And at one point I thought, okay, I'm going to change the world. But in the 20 years I worked there, I just saw the maternal mortality, climbing up. Women kept dying, and there was no perceptible change. For a number of reasons, I then went into public health. So I realized that maternal mortality is a public health issue. We need big problems down at the root level, addressing the problems in the field. And I'm very, very fortunate. I'm very grateful that now I'm at CCBRT for the last 2 years in a project that allows me to use my clinical skills and work in the field where actually patients go to the first level of care and try and make a difference there.
So tell me about the clients you currently work for at CCBRT. So how many clients do you work on and where are they located?
So currently I have the privilege of being the technical advisor of a project that is funded by the European Union and CBN. The aim of the project is to prevent disability, and our approach is preventing disability like fistula and cerebral palsy by making pregnancy safer. So we are preventing it by improving maternal care, and the aim is mainly to also reduce maternal and newborn death. And Tanzania is one of the largest global contributors. Maybe it's the largest peace-loving nation that is contributing significantly to global maternal and newborn death. Yeah. So the amount, for me, I'm a maternal health specialist, but the tragedy in newborn death is even more. And all of that is caused by poor care at the time of birth.
Okay.
So I'm working at 16 hospitals in the region of Dar es Salaam. We're working with the local government, the region health management team and the district. And in total, they do 100,000 deliveries a year. So that gives me a sense of satisfaction that I'm trying to contribute to making 100,000 deliveries a little bit safer.
So in your reflection of the 2 years you've been in your current role, what is for you the difference between the successes you've had and the failures you've had? When you've done that reflection with yourself and your team?
So I think about this all the time. This is my job. So what we have done is a very traditional capacity building approach. We've done the baseline assessment, all the building blocks that go towards capacity building, and we've done tremendous training, 169 people trained, 101 in infection prevention. We've got a real impressive list of training we've done. We've invested in infrastructure, we've trained in quality improvement protocols, we've brought equipment and supplies, and we've strengthened quality improvement teams. And we're assessing every 6 months. And what is becoming more and more clearer is that as the skills and competencies improve, there's a sense of ownership. The providers are feeling better about it. The quality of work is better. There's the attitudes. The patient-friendly care is improving. But there is a resistant, that's what I call a resistant gap in the improvement in infrastructure and human resource and support systems. And I've been thinking about it all the time, and hence having met you and listening to about management and how important it is for the leadership to be involved and to be engaged, I realize that has been a key gap, that we haven't invested enough in training the leadership, the people who could bring up the support system, who could provide the supportive environment. So I've been doing a lot of talking. So I've talked to the managers at the site and asked them, what do you think, what do you need? And each one of them says they want leadership training. And I've got about 4 emails that I could send you asking for leadership training. I also know that the traditional method of training has been classroom training, going for a course, going abroad. And sometimes my personal opinion is that is not contextual. It does not help them solve the problem in the field. And the reputation we are getting in our training is one of the reasons why the Ministry of Health loves us and the region loves us is because we follow on the training with mentorship. And if one thing that is our key strength and what we appreciated for most is mentorship. And I see you doing that. So if you could do the same thing in leadership, I see that that's a methodology that I've never thought of. So I don't have the expertise in developing leaders, in doing the management training. And I feel like I would like to employ the same approach that we're using in building skills into building leaders. And that's, maybe I'm jumping.
No.
I actually it completely confirms everything I've been thinking about. How are we going to do this? What next? What is the sustainable solution to this problem? And how can this work when the project finishes? How can this work without me?
Yeah.
Because I do not like the idea that this is being driven by CCBRT or driven by individuals, because that is the cause of why many projects fail.
So, initial question that people or feedback and people may give you is, this won't work. This is Africa, this is healthcare, we're different. This may work in the West in big pharmaceutical companies or big oil and gas companies, but this won't work here in Tanzania. What is your message to those people who really believe or really skeptical that this can actually be successful here?
So you're very right, and I must say that I have actually approached some of the best run industries in Africa are the tourist industries, the tourism. That's the one that's actually making money. So I've approached managers of really good hotels and I've asked them, can you run a management training? Can you teach my managers how to do service provision, how to identify problems? And they say, it's not possible now. It's not possible in the healthcare system. It's not possible where the budget is so low, the human resources are so under allocated, and it's despair. But I am a complete believer that if we give up, and I'm a leader, I'm an educated woman, I'm a mother, I delivered in the facilities here. If I give up, then there is no hope for the others. So my driving force is the women, my sisters, my daughter who's going to deliver in these health facilities. I have to make it safer. So I don't believe that there is no solution. I just believe we haven't found the one that works. And I will believe in trying every step of the way, trying any possible solution until we get to the one that works and makes a difference. And this is where I come. So Michael, can you do something? Can you please come on board? Because what I'm looking for is someone who can complement. We are planning to do capacity building. And many donors love it. They keep training and training and training. But we are forgetting the managers. So the investment in managers is disproportionate to how much we're investing in the healthcare provider. So if that, I believe that the two together would maybe make a difference. If it doesn't, we'll find out why and do it better.
Well, I want to leave with a last question in terms of, I know we have great conversations over the last few weeks about this particular subject, but in particular this video is directed to people living in the US, living in Europe, living in developed countries who have the capability to significantly help the leaders in the healthcare organizations that you're talking about. So with that in mind, and the people this video is going to be broadcasted to, what message do you have from someone who's on the ground on a day-to-day basis in these organizations? What message do you have for people in the world who have the capability, significant capability to help? What is your final message to them?
So my message would be that I am extremely grateful for the information I have learned and for the development I feel in myself over the interaction I've had with you. And I believe completely that every individual fully charged, working to full capacity, has the capacity to contribute to problem finding and solution. And we are obligated to try. And anyone who is in any position to make that possible. And if every individual works to their best capacity and every leader works to full capacity, I really believe that a change is possible. And anybody who can contribute to somehow solving that or making that happen, I would like to implore them to do that.
Thank you very much.
Thank you.
Thank you.